Let me give you 3 scenarios recently and one of a physician I know that lives in the San Francisco Bay Area. I have a friend who's a doctor in a major medical clinic in the San Francisco Bay Area. They have a single sign-on product. That product is a tap and pin, but it's clunky. It doesn't work well. That person has actually disabled that product because it inhibits their workflow. Recently I was at our surgery center, which is actually a top-notch surgery center. It's one of the best surgery centers I think in the nation. I was in the operating room. 3 out of 4 of us did not have access to the computer because we did not know our passwords. I generally don't need access. The nurses will log us in. And we spent 2 to 3 minutes having someone else come in and give us a password to get on the computer. I was at the hospital 2 weeks ago, and we need to change our password every 3 months. It was in between cases. I couldn't get on. There was a glitch with it. I had to call the information technology help desk. That person had to help me through it. 10 to 15 minutes later, they emailed me a new password. I logged in an hour later. So it's on a day-to-day basis that every physician, every nurse, every healthcare provider struggles with the login, log out, the sign on, sign out to protect the data that's held in our medical records. And that's where our new technology, it brings a beautiful solution, an elegant solution to this problem. Because of the advent of HIPAA and the new regulations with the HITECH Act, security is becoming more and more important with health information records. And that's a great thing. I mean, that's a great thing for patients. It's a great thing for our health personnel, our doctors, our nurses to think about at all times. But what it means for us on a day-to-day basis is an enormous loss of efficiency. It's a major productivity challenge. You know, when we're in our exam rooms, we have to be able to secure that data. But it's taken to the extreme because we need to lock our computers and time out quickly. It has to be on a even 10-second, 15-second, 5-second basis. So I'll be examining a patient, interviewing them, inputting data, and I'll turn around to examine them, look back at the computer, Control, delete, log on, my password. Absolute nightmare. And that's day-to-day, patient after patient, multiple times a day. I've done the numbers on that, and if you average 5 to 10 seconds per login, if you average 5 seconds per login, that comes out to 48 hours a year. And that's just me. That's one healthcare worker. So if you extrapolate that out to my MAs and my partners and the whole nation, just imagine what that means for productivity loss. As a physician, I have probably 2 to 3 applications that I need access to every single day, and I need to launch those programs. And at the same time, I need to secure my desktop, whether I'm here or in the operating room. But the way this works is all I need is this. It's a badge that I wear that talks to a sensor, and by me being in this room, it knows I'm here. And when I'm here, it brings up my applications. Now, those applications can be brought up by just being in proximity to it, just being here in the room. And if we need to, we can change the demand for biometrics at any time. We can make it so that it needs to be biometrically authenticated every single time. Or usually for me as a healthcare worker, it works out well for me to need to do that twice a day. So when I come in the morning, I biometrically authenticate, and at 1 o'clock p.m. After that, all I need is my badge. So it simplifies everything. And one of the best things, other than it knowing me when I'm here, it knows when I'm gone. So when I leave, it locks up my computer, it secures my computers, and I don't need to worry about my security.